Good morning, sir. Good morning, classmate. And the year that was assigned to me is year 2004. So let us start our discussion with all about sports. So in year 2004, the world's most popular sport is soccer, which is also very popular when it comes to Olympics. In year 2004, based on newspaper articles, athletics was the second of the most popular sport at the Olympic World. So, pinaka-popular nung taong 2004 na laro ay soccer. Ang pumapangalawa dito ay ang athletics. The most played sports in year 2004 were football, gymnastics, basketball, boxing, wrestling, volleyball, table tennis, badminton, water polo, swimming, track and field, and tennis. So, the Philippines received major awards like champion during the Asian Women's Softball, champion 2004 SBL Season 80, champion during the Asian Amateur Boxing, champion during the NCAA Season 80, champion during the Philippine at the 2004 Summer Olympics, champion Philippine at the 2004 Summer Paralympics, champion during the UAAP Season 67, champion during the V-League first and second season conference. So, ibig sabihin, noon pa man, hindi na nagpapatalo ang Philippine pagdating sa mga sports. Parati nang nakakakuha ng mga awards ng Philippines kahit noong taong pamang 2004. The Philippines competed at the 2004 Summer Olympics in Athens from 13th to 29 August year 2004. This was the second of the Philippines to join in the country's 18th appearance at the Olympics, except the 1980 Olympics in Moscow. The Philippine Olympic Committee or POC sent a total of 16 athletes, 12 men and 12 women competing in 6 sports. The Philippine Olympic Committee or POC sent a total of 16 athletes, 12 men and 4 women competing in 6 sports. Boxing veteran Romeo Brain was the nation's flag bearer in the opening ceremony. The Philippine team left Athens without a single Olympic medal for the second consecutive time. Hindi pinayagan ng Pilipinas na hindi makauwi ng iisa lamang na medalya. Among all the athletes, welterweight taekwondo Mary Antoinette Rivero only progressed further into the semifinals. So, let us come now to the health issues in year 2004. The available health resources are not only inadequate but also inequitably distributed in year 2004. In that year, there are 548 government and 1,146 private hospitals. The government health workforce comprises 2,848 doctors, 4,945 nurses, 16,173 midwives, and 14,267 staffs working in barangays and health stations. Based on the populations in 2004, the government health workers has a ratio of 1 doctor per 9,727 people, 1 dentist for 36,481, 1 nurse per 7,361, and 1 midwife per 4,503 patients. So it means that during that year, in that year, there are a lack of medical experts. This situation has been aggravated by increasing number of health workers gaining employment overseas. Isa ito sa mga naging rason kung bakit marami yung nagsisi. Away from physician, both general practitioners and specialists have been shifting to nursing in order to cash in on the great demand for nurses in the USA and the UK. So, we have the major health issues happened in the year 2004. First, healthcare costs continue to rise. Consumer bear more than of the burden. The number of Filipinos lacking health insurance keeps growing. The cost of the new Medicare Modernization Act, or also known as MMA, with confusion over the drug discount cards provided by the law. Healthcare was a prominent issue in the election campaign. in the election campaign concerning growth about the national's drug development, approval, and monitoring process. Patient safety and medical error gain increased attention in the debate over improving the quality of care. A mixed picture of states pursue a number of initiatives to cover the misuse in an era of increased financial pressure. Increasing recognition, the Philippines spends more than other countries in the healthcare but doesn't systematically get the best results. The shortage of influenza vaccines and more talks, not a lot of action in healthcare.